Hi, I have been receiving a lot of questions from you about stress urinary incontinence and sling. I would like to answer all those questions. Hi, my name is Dr. Alexandra Dubinskaya, and I'm a urogynecologist and a founder of Los Angeles Institute for Pelvic and Sexual Health. Okay, so is sling a real mesh? You can't imagine how often I get that question. Yes, sling made out of synthetic material that we call mesh, and it's exactly the same material that being used, for example, for hernia repair, and we use it differently than the mesh that been used for the vaginal prolapse repair. If you're worried about the safety of using that mesh for the sling, I want to assure you that it's very safe, and it's actually considered to be a gold standard in the treatment of stress urinary incontinence. Do I need to stay in the hospital after the surgery? No. The sling procedure is outpatient procedure, meaning that you go home on the same day. Will sling stop working after a certain amount of time? It depends. In the studies, we know that at about 12-year mark, 98% of women are still happy with their sling. So unless your body undergoes a lot of changes, such as gaining a lot of weight, losing a lot of weight, or having a pregnancy and vaginal birth, your sling should work for you for many, many years. Do I have to be done with having kids in order to have a sling done? It's a very good question. There are two schools of thoughts. One that believe that yes, you should complete your family because where the area where we place the sling might be affected by you giving a vaginal birth. Other school of thought is if you're miserable with your stress urinary incontinence, you can get your sling done. And if you get pregnant after, we can have another discussion about risks, benefits, and safety of having another vaginal delivery or having a C-section. Will my partner feel the sling during sex? If the sling placed well, your partner should not feel anything. In rare cases, there could be a complication of mesh protruding through the vaginal wall and causing irritation. That complication is very easily treatable with excision or application of vaginal estrogen. If there is a bleeding, if your partner feel like a little pokey sensation during intercourse, you should definitely see your urogynecologist to get evaluated. Stress urinary incontinence is a very common condition, and I see patients with that every day in my practice. So if you have more questions or think you might have a stress urinary incontinence, call my office so we can schedule the consultations and you can get your full evaluation.